we appreciate the opportunity. Consumers Union is the nonprofit independent publisher of consumer reports, and we don't just test toasters. We try to help people with health issues. We're really using comparative effectiveness research to save folks millions and millions of dollars on the safest, most effective brand and prescription drugs. We support reform of the health system. Our readership tells us it's a top priority. My testimony documents why, and we have stories from many of your congressional districts, particularly moving ones from Mr. Courtney's and Mr. Lobsec's districts in the back of my statement. So how to save money? One thing to do would be to set up a federal office to work with the states, not take over, but work with the states in collecting and sharing information about consumer complaints and emerging fraud issues. State enforcement of insurance laws, anti-fraud issues, very uneven. And we need to do better. And the basis of that recommendation comes out of a court case in the Newark area, sir, and a settlement by New York AG Cuomo this spring in the United Health case that is so seemingly obvious, and how did this go on for so long? You feel it's almost Homer Simpson-like. The issue involved, and I'll show you some math on this, the issue involved is most of us, 70% of us, have a point of service or PPO kind of health policy where if we need a specialist, we can...
Excuse me, maybe the young lady can stand so all the members can see the chart.
If we go out of network for specialty care, or if you want to go up to Hopkins for a specialty operation, you can go. But you have to pay, of course. And let's say the doctor charged you $200 and the usual customary and reasonable fees in the area were $200. So in an 80-20 policy, you'd owe $40. Well, another procedure, doc charges $200, usual customary reasonable is $150. You, the insured, pay $120. You owe $80. You still owe the doctor the $200 he charged. UCR, where's that come from? Believe it or not, it's from subsidiaries owned by the insurance companies. And Cuomo in the court cases basically found that over a period of a decade, those numbers were getting lowballed. Thank you very much. Those numbers were getting lowballed, and consumers were paying hundreds of millions of dollars over a decade more than they should have. Senator Rockefeller says paying $1 billion or more. That was such an obvious conflict of interest. Why did it take so long? If we had a federal office where the first complaints were coming in around 2000 from the AMA, why we need somebody to help say, hey guys, something's happening out there, let's get together and protect consumers. As a consumer rep, I hate to say it, but most of us are pretty terrible shoppers for health insurance. Sorry, Neil, but honey, let's go shopping for health insurance this Saturday morning would put fear and dread in most of our hearts. And we leave a lot of money on the table. We don't get a great deal. And the documentation for this is in Part D and in FEEB plans. We're not getting the best deal. So if you, in this reform bill, if you want to use consumers to drive towards value and to drive towards savings, we need some help big time. We need an office that will maybe grant grants to states for one-on-one counseling. We need a site that would compare quality and effectiveness and price of insurance plans. Very important, we need some standardization of definitions. Our current issue has a couple, thought they had hospitalization insurance. Fine print, started on the second day. After the lab tests, after the surgery room charges. They ended up with a huge bill. Darn it. Hospitalization means hospitalization. Drug coverage means drug coverage. Means chemotherapy. Means the antiemetic that lets you take the chemotherapy. We need some definitions like that so that people know what they're buying. But most important is there needs to be a marketplace or a forum where people can make meaningful choices among a manageable number of plans. In FEEB, in Part D, in Part C, we're looking at 40, 60, 80 plans. Consumers just shut down. Most of these are meaningless, ticky little differences. Give us some major choices in a format where we can shop. And before you sign up for that policy, you see the price and the quality ratings of the comparable plans in that category. Thank you very much, and I hope that this can become a great historic Congress which will finally solve a century-old effort to get dependable, quality, affordable
Thank you,
health
Mr.
care.
Vaughan. Although